David, thank you. And now, Dr. Arf, we'll take it from here. Mr. President, today we are making American health technology remarkably great again. We've always been at the leadership. David's right, I called him early on after the president offered me the position and him as well. And we began brainstorming on this. Secretary Kennedy from day one appreciated the crisis that we're in and how we needed to address it. So today is a remarkably important day, one that you will remember, I believe, for years to come for three reasons. Yes, it is the 60th birthday of Medicare and Medicaid. The first patient, by the way, was Harry S. Truman. Although Lyndon Johnson signed the legislation 60 years ago today, not far from here. It is not just the ability to bring 60 of the top incumbents and insurgents in health technology, hospital systems, insurance companies, electronic medical record companies, AI companies, the big players, you're all here, and we appreciate that very much. But Mr. President, you used the power to convene. That's fundamentally what I think the president has been able to offer us. And Secretary Kennedy offered us, as a group, some examples, but there are more to come. And I want to touch on some of these. But first, I've got to do what doctors often have to do, which is to tell you the truth, even if you don't want to hear it. So here goes. These beautiful programs, which are the backbone of the social network, the social support system of this country, the safety net, they're flailing. They're flailing for a bunch of reasons. Medicaid is a unique entity. It has deviated from its original purpose by drift and by design. The One Big Beautiful Bill, the OB3 law, was elegant for that very reason. And President, I don't know if you remember this, I can share this, but he called me once and he was upset at me because I was going too strident at something. And he said, this is about fraud, waste, and abuse. That's what we're interested in doing. And that's exactly what the One Big Beautiful Bill accomplished. And it especially did it to save Medicaid by putting $200 billion more dollars into it and allocating funds very specifically to use to support rural America. And primarily, some of that money will be used to support digital infrastructure, which is terribly lacking in many parts of the country. The money that's sent from Washington doesn't get to rural America. About 7% of Medicaid dollars get to rural hospitals. We now have an ability to infuse funds through this $50 billion Rural Health Transformation Fund into that system. The gathering today is another example of how we can actually jumpstart that and accelerate it. The other reality is COVID broke the system. It did for many reasons. Medicaid expenses went up 50% in 5 years. Medicare, the trust fund that we met at actually Treasury with Secretary Bessent and Secretary Kennedy as trustees, it goes bankrupt in 2033. And that is actually a conservative estimate. It could go bankrupt as early as 2029. Thankfully, due to the economy, that's not going to happen. But we don't want to have to take that risk. And there's some fundamental changes we need to make accordingly. Now, there's one other big reality about making the system more efficient, which is why what everyone here is talking about is so critical. And let's just pick an average American born in 1964. That average American born in 64 will retire this year at age 61. If just that one group of people born in 64 could work 3 years longer because they're healthy, because they feel like they want to do it, because they feel vital and vigorous and they're flourishing, just that 1 year working longer is $1 trillion to the U.S. GDP, and is $300 billion of tax revenue to pay for a lot of the problems that people are concerned about. So it's not just keeping people out of the hospital, getting them to thrive and flourish that makes what we're doing so critical today. I think there are a lot of realities to how healthcare has gone. Unfortunately, this system is frozen, and it has been for many reasons, despite efforts in the first administration. It's frozen in time, so it cannot address the quality lags that exist. While Netflix and Airbnb and Uber drivers are racing ahead, making arrangements, identifying the problems that are challenging us in healthcare have become incredibly difficult. You can't make appointments. The average Americans are tired. They're tired of waiting for a doctor's appointment. They're tired of waiting for the surprise of what your hospital bill is going to offer. That's being addressed by one of the president's executive orders. They're tired of waiting for access to their medical records. You own your medical records. They're yours. Why you can't have access to them is a stunning reality in modern day America. They're also tired of waiting for Washington to take action. And this president early on emphatically stated that wasn't going to happen anymore. And today we made that vision into a reality. And there's a fine line between vision and hallucination. What you did today was show it's a vision because you share it with us and we're moving ahead on it. And that's what today's commitments essentially are reflecting. And they are pledges. They're not laws. They're nimble and they're fast and they're quick because the president understands that you, Each of you, in your own way, understand these needs. And Secretary Kennedy spoke beautifully about the reality of what happens when you actually have electronic records, because what he said is happening in Indonesia, we'll have here. Within a year, on your device, and 91% of Medicaid patients have smartphones. On this device, you'll get insights based on your records if you want. You don't have to take this, but if you desire, Amy Gleason is one of the smartest people I've ever worked with, has built a mechanism to be able to get you that information in a way with all these partners helping so that you can get nudged to pay attention to what you're eating and avoid processed foods that Secretary Kennedy smartly and wisely highlighted as so dangerous to our well-being. All this, by the way, is that will be at the fingertips. In addition, advice about which doctor to see, when to go see them, nudges, reminding you why I didn't do certain things. If you're a doctor like me, it's a very different story. It's to help you navigate the system better. It's giving you advice, decision support, which is becoming increasingly important as medicine gets more difficult. But I'll tell you the best thing of all, how many of you have been with your doctor telling them something heartfelt, very emotional, and they're looking to the side, typing into their computer, right? It's common. Put your hands up. I just want to see it. Yeah, most everybody.